The scapula is part of the pectoral girdle. The human body has two scapulae, commonly known as shoulder blades. The bones are located on the posterior or dorsal side of the body, between the second and the seventh ribs. The scapula is classified as a flat bone with a triangular shape. Many structures of the bone serve as a point of attachment for either the origin or insertion of a muscle. Like all triangles, the scapula has three borders, including a superior border, a medial border, and a lateral border. The lateral border is the point of origin for the teres minor and the triceps brachii. The medial border runs parallel to the vertebral column towards the midline of the body. Rhomboideus major and minor insert into the medial border. These two muscles allow the scapula to retract and rotate, and they also stabilize the shoulder. In addition, the scapula also has three angles like a triangle. The inferior angle is located at the junction of the medial and lateral border, and the inferior angle is the origin for the teres major muscle. The superior angle is at the junction of the superior and medial border. The lateral angle is at the junction of the superior and lateral border and is primarily composed of the glenoid cavity. The glenoid cavity is a shallow fossa where the scapula articulates with the humerus. The head of the humerus fits into the glenoid cavity of the scapula. The two bones form the glenohumeral joint, which is classified as a synovial joint. More specifically, is a ball and socket type, allowing for multi-axial movement. The scapula has two tubercles. One is the supraglenoid tubercle, located superiorly to the glenoid cavity. One tendon of the biceps brachii inserts into the supraglenoid tubercle. The other tubercle is the infraglenoid tubercle, located inferior to the glenoid cavity. One of the triceps brachii heads originates on the infraglenoid tubercle. The anterior surface of the scapula is relatively smooth and slightly concave, forming the subscapular fossa. The subscapularis muscle originates on the subscapular fossa. The coracoid process looks like a bent finger and is located at the superior lateral border, projecting anteriorly. The pectoralis minor inserts into the coracoid process, and one tendon of the biceps brachii originates on the coracoid process as well. The suprascapular notch can be seen medial to the coracoid process on the superior border. The suprascapular notch is the passageway for the suprascapular nerve. A prominent spine can be seen and felt under the skin on the posterior surface of the scapula. The spine ends on the lateral side of the scapula with a projection called the acromion process. The acromion process is on the posterior lateral side of the scapula. The trapezius inserts on the acromion process and spine. And the deltoid originates on the acromion process and spine as well. The acromion process is also the point of articulation with the acromial end of the clavicle. The two bones form the acromial clavicular joint, which is a synovial type of articulation. The joint allows for gliding of the scapula on the clavicle. The spine divides the posterior surface of the scapula into two fossae. The supraspinous fossa is located superiorly or above the spine, and the infraspinous fossa is located inferior to the spine. The supraspinatus and infraspinatus muscles lie between the fossae. This is easy to remember because the similarity of the fossae names with the muscle names. The scapula is protected by a system of complex muscles. Fractures of the scapula is rare, but when a fracture occurs, it is often due to a car or motorcycle accident or falling from a high structure. The typical symptoms of a broken scapula are extreme pain when a person moves the arm and swelling around the back of the shoulder. Commonly, the fracture can be treated non-surgically, having the patient wear a sling to hold the shoulder in place. When a fracture occurs on the acromion process or on the glenoid articular surface, surgery might be needed. Metal plates are placed to hold the bone fragments together. The scapula is important in protecting the lungs and the heart on the posterior or dorsal side of the body. The bone acts as a shield in case of an impact on the area. The scapula is also an important bone for the movement of the superior appendages. The shoulder joint forms the most movable articulation of the human body. The joint is not very stable to allow freedom of movement. Shoulder dislocation is a common injury due to the lack of stability. Any problem on the shoulder joint would affect our ability to move the upper appendages.